Fabio, great
Here,
to see you again. So let's handle this really controversial subject right now. Socialized medicine, single payer healthcare.
so scary.
I'll say that years ago when I was growing up and I had, a fairly liberal father, and a very liberal mother, but I kind of had my own, like, I don't know, that single, I had skepticism towards anything social, anything that's super socialized. And I guess I still do to some degree, but from what Bernie Sanders said in the last primary, I started to look at the numbers that he was suggesting about European countries paying basically on average half as much as Americans are per person for essentially the same or better coverage.
Mhm.
And I was like, how can that be? And I did a little bit of sleuthing and discovered it pretty much seems to bear out in reality. Now, obviously, wealthy people are going to always get better healthcare privately if they've got the money. But as far as the public is concerned, the majority of the country, would it be better for America to go with a single payer option?
Yeah, it's out, I hear the arguments and I don't know whether they are real arguments, both pro and against. I see the argument being made mostly on a financial basis, but I don't even know whether that's the right way to approach it. All I know for sure is that I lived in three countries, including the US, for a long time. I was born in Italy, and then I lived in England for 20 years, and then I moved here. So we had public healthcare in Italy. We had public healthcare in England, and there is private healthcare here. I worked as a physician both in Italy and in England, and I haven't worked as a physician here, but I have a lot of interactions with the health markets because both unfortunately as a user, especially since March, but also as as part of my job. And I'm not sure how logically those two systems can be juxtaposed as one being better than the other. What I've seen, my experience here of using healthcare, I pay for my private insurance myself because I'm on a contract, so I don't have the benefits of my job. So I need to purchase my own insurance. I pay $740 a month, and that was the cheapest insurance I could find. And I've been having problems this year. I've been using health facilities more than I ever have into my entire life. And frankly, my experience of the American healthcare system is quite mediocre in comparison to Italy or to the UK.
Mm-hmm.
What changes is the focus on customer service. So, in Italy, you wouldn't have the nurse coming to check on you 20 times and say, how you doing? There isn't that much amount of courtesy and kind of a pampering around things. But, when it comes to the core of the services provided, I really feel that there is a significant difference. My primary care physician in Italy, in the UK, and here in the United States are basic primary care physicians that I could put one in another country and wouldn't know the difference. So to me, the argument is around, is this efficient?
Right.
Is this system efficient? And I don't think it is, at least from my experience. From a financial perspective, it's certainly not efficient. It's very expensive to anyone to utilize the healthcare system.
So let's break that down right now.
Right.
Like, so what Bernie Sanders was saying was that basically you've got these middlemen of the insurance companies that are taking basically a 20% cut across the top. So
Right.
already you're losing 20% of your nation's money toward healthcare to middlemen who don't need to be there. And you say that, and like all of a sudden there's this whole medical people going, oh my God, you're gonna phase out an entire industry. It'll send us into a tailspin economically. Well, yeah, but that's what economics does, is it makes things more efficient. If this is an inefficient system, then it should be updated, right?
I mean, the airline companies are just kind of planning laying off 35,000 people, right? Because of the COVID crisis. So I don't know why we need to protect other industries like the insurance companies.
Which produce absolutely nothing of actual net value to the system. They're middlemen. That's what middlemen do.
They produce what insurance companies produce. So they produce a management system for a diverse and heterogeneous market, and they offer a way to actually standardize the interface with the customer. So,
and is anyone really happy with that interface?
I don't know how can anyone be happy with the level of insurance, with insurance companies. But again, my only contact with insurance company is about prescriptions, and I think that here prescriptions are just as restricted as they are in Italy and in England. I know people that take very expensive medicine in Italy, in England, and in the UK, here in this country. And here in this country is a nightmare. In those other countries, it's not.
So there's an argument I could hear a conservative say that basically the problem with socialized medicine is that you're going to have lines, and it's going to be, you're going to have to wait months like they do in Canada for certain surgeries, and they're going to cherry pick essentially the worst things about socialized medicine and say that's what you're going to have across the board. What do you say to that?
Well, it's we got lines here. I waited for 2 months to get a cardiologist referral. I waited a month and a half to get a cardiologist assessment. That was kind of fairly urgent because I was under an emergency situation. So my personal experience is that this is not, I do a lot of work in the pharmaceutical industry, and we look at time to diagnosis for different diseases. And my area of expertise is around autoimmune disease. So I know about inflammatory and chronic disease and autoimmune disease. It takes as long as in this country to get diagnosed as it takes anywhere else. If anything, it takes a little bit longer because there is less cooperation between specialties in this country because there's so much heterogeneity. So it's difficult for patients. It's more difficult for patients to navigate a multi-specialty environment.
Okay.
So yeah, it takes at least 2 physicians to actually get a diagnosis, and at least 6 months.
So let's talk about this pharmaceutical aspect of this too. I mean, there's a lot of complaints that our medical culture is very pharmaceutically driven. And so I think a lot of fears of some people I know would be that if we had socialized medicine, it would force everyone into a culture of medicine that they don't necessarily like. That basically it's like, oh, well, we're going to plug any problems you have with these drugs, and that's how we solve problems. Whereas if you have private insurance, maybe you'll be able to select doctors more particularly to your desires.
But you can do that anyway, because in single payer systems there is an open market. So, you go to a hospital, you don't like the doctor at the hospital, you go to another hospital. My mother is 87, and one of her favorite pastimes is actually to go to the doctor. She goes to a myriad of doctors, and she never had any obstacles in getting a doctor.
All right. So where we were talking about this fear that many people have that if a public option happened, if we had socialized medicine in the United States, would they have options to have a doctor that's, more integrative medicine, or, have a different approach to healthcare, or would we have all the same culture of healthcare being pushed on us? And that I think that's a fear that a lot of people have around the single payer idea.
Right. Yeah.
Because people see the pharmaceutically driven healthcare system as problematic, which I actually do. Culturally, I see the healthcare system as it is to be somewhat top heavy with the drugs, which seems to be more often plugging symptoms than seeking out underlying, this may just be my bias, but rather than seeking out the cause behind different illnesses, it seems like most of the healthcare culture is just sort of stopping symptoms. And I think that's kind of partly because that's what Americans show up at the hospital wanting. It's like, can you give me a pill for that? Rather than, oh, do I have to exercise, stop smoking, stop overeating, change my diet, change my lifestyle to be a healthy person again? Instead of asking any of those questions, they're just like, hey, what pills can you give me?
Yeah. I think we are mixing a couple of, overlapping, but probably not completely.
It's a conflation, right? It's a conflation of things. That's why
several
this discussion gets clogged, right?
Yeah. So maybe the best way to address it is actually to break it down, I guess, right? So with a single payer, do you have a choice? And the answer is depends how you structure the single payer system. So if you have a single payer system where the single payer is is a replacement essentially for the insurance company and somebody that sets the standard of healthcare, then yes, there could be broader differences in the approach to healthcare that different providers give. But in reality, what's happening in the US is not, again, there is an illusion, and maybe this is something that happened in the 50s and 60s, but certainly it's not happening now, where the medical profession is that, and in a hospital setting, you have to obey to certain standards and protocols. And those protocols go for everybody because they are mostly set up by the payers, which are the insurance. And therefore they apply to multiple environments. So you're likely to get, if you get hypertension, you're likely to get exactly the same standard of treatment across all different facilities. The speed at which you might get it, the type of medication that you go on to on the second or third tier might be different because of your level of insurance. But mostly that's what guides any prescription. So I'm really not sure how we can believe that that is a problem with single payer. I think it's a problem with any system that homogenizes healthcare according to a standardized protocol and according to, we had a brief discussion before about, this kind of evidence-based medicine that is based on a pharmacoeconomic model.
Right. And so there's a pharmacological bias in a lot of our medicine culture today, even in the scientific community, right?
Well, then you're talking about something different, which is remedial versus preventative healthcare and integrated versus again, remedial, pharmacological based healthcare.
And so you're saying that this when I think about redoing our healthcare system, I think about this very issue. I think about refurbishing the entire culture of healthcare to make it preventative, because if it's single payer, there's no disincentive to get treatment or blood work or whatever as early as possible. When you're a young man or woman, why not have, be getting some tests to see where your blood work is going, or what you're being opened up to for diseases later on in life. Why not pursue that if the whole system is one system? No one's trying to dramatically save costs now, because the whole system together wants to save costs overall and into the future. And so then preventative medicine also all of a sudden becomes a financially wise thing to do, right?
Yes, yes. On the other hand, I don't believe that is the standard in many single payers markets. So I think again there is a difference between the practice of medicine, evidence generating medicine, cost effectiveness and pharmacoeconomics, and the system. So you can have the same issues about access in different markets, whether they're private, public, or mixed. Can you hear me? I think I pressed.
I can hear you.
Yeah. So you could have the same issue across markets. I don't think that that's a characteristic of a single payer versus multi-payer.
Okay.
At the moment, if you go to any pharmacy, and I don't know if it happened to you, but it's happened to me several times living here. That my doctor gives me a prescription, and then I get a call from the insurance say, well, your insurance doesn't cover this prescription, and either we get something else or you are got to pay. And when they ask me to pay, it's like ridiculous amounts of money. So there is no freedom that I can detect above and beyond what I experience in a single payer market. I think that it is a more expensive system because there are more middlemen than in. But the basic principles of health economics, pharmacoeconomics, effectiveness, and evidence-generating medicine are now mostly global. So what you're talking about, it's a revolution in healthcare where we actually move the attention from a remedial, evidence-based, we treat we treat an existing disease, rather than focusing our attention in preventing disease in the first place.
Right.
That's not really something that happens in many markets that I know of.
Well, this is, let me wax philosophic about my vision about what healthcare could be. Because to me, once you start thinking about rebuilding it from the ground up, and I don't mean actually from the ground up, because you still have a whole body of medicine science that you can't rebuild from the ground up, it's already established. But if you think about the culture, if you think about this culture and this country as a tribe of 320, what are we up to now? 340 million people?
320, I think, yeah.
320. Just think about us as a tribe. If you were in a tribe of 150 people, and there's one witch doctor in your tribe, and they have mixed results, but people get better sometimes when they're being treated by the witch doctor. That witch doctor, maybe gets payment in barter for a chicken or some sort of, berries or some gift in exchange for services, whatever the other individuals can afford. But the witch doctor is not going to decline someone's treatment just because they don't have something to offer if they're part of the tribe, right? This is a moral imperative. What?
Ideally, yes.
Well, I just think but in a tribe of 150 people, I mean, what kind of stigma would be attached to denying care to somebody? in the tribe to that witch doctor.
Yeah, I think it's a moral issue. You know,
It's a moral issue. And we already have declared this moral issue in the right direction, because if someone shows up at the ER, they're legally required to treat them, right? They can't, I don't think a hospital is allowed to say, no, we're not going to treat you. It's like a moral conscience issue that I think they can go to jail if they don't, right? I mean, there's legal ramifications of denying immediate care. But this is super expensive. The ER model is super expensive. I've seen some research done on particularly on homeless people, and this is why the idea of putting homeless people in apartments is actually more cost effective for the city than not doing anything, because when they show up at the ER with incredible health problems due to being on the street for months, all of a sudden their cost to the city goes up $100, $200, $500,000 in a matter of weeks.
Per person.
Per person.
Yeah.
So if they had just spent $40,000, $50,000 on a social worker and a cheap subsidized apartment, they would have saved themselves hundreds of thousands of dollars as a city. And I think Salt Lake City basically did this model and proved that it worked. It saved them money. And so when you have this idea of socialized medicine, that the network covers everybody, which we already do, then it's just a matter of going, okay, let's think about how to make this system more efficient. And I think obviously the way to make it more efficient is to be preventative, to go, well, how do we get ahead of the diseases that are going to be crippling for our workforce later on in life? And I think that means that you do look at people's health early on. You find people who are obese, and you immediately go, hey, do you need some social services? Maybe it's a psychological problem. Maybe it's a physical problem. Like, let's help you with your obesity. And you know that America's 40% obese and 70% overweight. That has got to be contributing to our incredible health problems.
Well, it does. Not only it contributes to the incredible health problems, but contributes to morbidity, contributes mortality, contributes to healthcare costs, contributes to life expectancy, and many other everyday things. But you see, this is the dichotomy that we have in this country. If you work in a large corporation and you get healthcare benefits, these benefits also come with a free gym membership, wellness programs, counseling programs, support programs, childcare. All that is provided within a corporate organization. And your healthcare costs are much lower because the company negotiates a rate with an insurer, and therefore you get less expensive healthcare. In the UK, for instance, so I work in corporations both here and in the UK. In the UK, you also have benefits. You know, you get dental care that is not part of the national health system. You get vision care that, again, might not be part of the national health system. You get extra discounts for private healthcare if you want access to these things. So there is a off. You know, you kind of basically get extra on top of what is already provided to everybody. Yeah. The issue is around rationality of the system. Why do I have to spend, you know, even from a pharmaceutical company perspective, they have, every time a medicine is launched, each company needs to negotiate with 5, 6, 7, 8, 15 different payers. And you go and you have a craft of people that have to go and prepare dossiers for hundreds of people, and they get a different response from everybody, because everybody has their own individual bias and perspectives. Why do we have to have healthcare as so expensive? not only because you got the overheads of the middleman, but because the middleman works for a for-profit organization. So they have to make money at the end of the year.
Right. And so you create all this conflict, sort of these battling communications within the system that doesn't really need to be there. I mean, it could be forged more on principles of let's maximize health and minimize costs. Which mostly means preventative, because preventative care is cheaper on average, right?
Yeah, let's get there in a second. I think that, first of all, I think it gets, so the system is based on a principle. The whole system is based on a principle that the free market allows innovation and competition.
And that's true with LASIK, for example. With LASIK eye care, that was true. When LASIK came on the market, it was experimental. No one covered it. It cost $10,000 per eye. Right. And then like 10 years later, it's $2,000 for the whole job. Right. And it's much better than it used to be.
But you have LASIK, you know, in America, and you have LASIK to pay for, and you pay for it in England, in Denmark, and in Germany. It's not, or in Canada. It's not that different. You know, there are still services, you know.
But did the private market make it, the competition make it more efficient somehow? Did it make LASIK more efficient?
Maybe. You know, I don't know. What I'm saying is that competition only works if there is an ability to compete. Right now, we are not in a, you know, there is no competition. We can talk about healthcare, we can talk about other subjects, but there is real no competition between insurers, right? If you go and have a quote, more or less, they all give you the same benefits at the same price. It's all negotiated. It's all, you know, and then it becomes a preference of whether you live in Los Angeles or in San Diego or in La Mesa or in La Jolla, right? And you choose the provider that covers the...
or it's based on the company you work for, and they had to make a decision for the entire company, which is not necessarily good for you as an employee. Right. So it's really not, especially there's not much choice. In other words, there's not much choice.
So the choice is actually not there. The competition is not there. What's happening, and that's my personal opinion, is that this environment, instead of spurring innovation, is actually thwarting it, because the pharmaceutical industry gets into a standard where they have to produce medicines that can be compared to something that is already there. And comparing medicine is really, really complicated for a number of reasons. And then you have to make all these arguments that are only on the base. So you need to produce something that looks exactly the same as something else to start with, or better. And then you have to produce all this information about the fact that convenience and price and route of administrations are actually what makes the difference. So we're actually not innovating much in healthcare. Innovation, you know, I remember the US in the 70s and 80s, because I'm that old. And I remember that we were doing, you know, collections in Italy for children with cancer that could only be treated in the US, for people with heart conditions that could only be treated in the US. Now, people go to England, they go to Germany, they go to France. They don't really go to the US anymore, because the standard is not that different from that of markets where you actually have a single payer. So I think that there is a lot of perception here, and again, probably an ideology behind the concept. And to me, the ideology comes to the point that, do I pay out of my own pockets, or do I pay and give it to the government? Right? Because you pay either way, right? So not having health insurance, to me, it's a non-choice, because at some point in our lives, we will all need to see a doctor. Maybe later, hopefully not very frequently, but we will need a doctor at some point. So as I pay for car insurance, as I pay for home insurance, as I pay for, 150 types for my phone insurance, everything that we have and we own is actually insured right now. And it's a requirement, right? So if you have a mortgage, you must have home insurance. But instead of giving my money to somebody who's got to make 20% off the top, and he's going to give me a service for a certain amount, I don't see the difference of contributing that money out of my paycheck. At least I can deduct it as an expense, because at the moment I can't even deduct my health expenses from my tax. So it seems to me not very logical. And it seems to me attached to an idea of healthcare, of American healthcare, that was true 30, 40 years ago, but is no longer true.
Yeah. And the pharmaceutical lobby in Congress is the most powerful lobby in Congress, or it has the most money, at least, spending the most money on lobbying of any one group. So it begs the question: is the system for the people, or is it for the pharmaceutical companies?
Well, I don't know whether the pharmaceutical companies have a huge vested interest in maintaining private healthcare, because many pharmaceutical companies and many successful pharmaceutical companies actually come from Europe. The largest pharmaceutical companies in the world actually have headquarters and were born in the UK, in Sweden, and in Switzerland. All places where healthcare is public.
It's public. So yeah, interesting.
So, American companies certainly, there is the advantage here is that you can increase profits because the price is not fixed by the government.
Right.
So but it is the same in the sense that you don't deal with the government to agree on a price. You deal with a private middleman,
right,
which is the insurance company or the payer.
So what would you say is the real problem here? Is it just cultural? Is it just that we're sluggish to move to make things more efficient? What is it that's stopping a better system, a more efficient system from taking place?
Yeah, I don't know. I think there are several layers. Again, one is a different concept that, Americans are against free stuff, and it's free healthcare, free education is a socialist country, and they're mostly against big government, which I get. I'm not a big government guy. I come from Italy that has a huge government, and it's widely inefficient and mostly corrupt. So we have 52 governments since the end of the Second World War. It's I look at America as a place where there's actually still opportunity. When it comes to the health system, I think that as many conversations today are driven by ideology rather than rationality. And again, it's this idea that there is a dichotomy. It's either we do it like a socialist country or we don't do it at all, right? It's that there is no creativity or way to say, okay, let's step back for a second and see what could work.
Right.
Because
it's just fear. It's religious fear around the word socialism, I would say. It's like, no, we can't even discuss that. But we already have that, is the problem. We have it, and it's inefficient the way it's being run.
Over the last 6 months, we've been one of the most socialist countries in the world. The government has been giving out thousands of dollars to people and paying out, unemployment benefits over and above the minimum wage. And that hasn't happened anywhere else. that I know of. That giveaway,
So much for Trump's small government, right?
$6 trillion of deficit, under the Trump presidency, is not a sign of small government, quite honestly. It's a sign of a very large government, but a government that takes from the people and gives to the corporations. So it's, to me,
Not
it's
that I blame him entirely. This is an unprecedented situation. So
yeah,
I'm not sure that I disagree with it. The
it
decision.
was brewing, right? It was obvious that the system is not geared to deal with any crisis.
Mm-hmm.
The financial, economic, and social system in the U.S. is not geared to deal with a existential crisis. That's why when disaster strikes, there is a huge call to intervention, and a lot of charities. Again, it's the inability to cope with the unknown. But
Yeah.
with healthcare, I really don't see the efficiency of the process. I don't see the advantage to the patient, to the.
So let's discuss this for a second. This is the argument. The argument behind libertarianism and capitalism in general is that if you make everyone pay for their services, they will make different choices, and that will make the system more efficient. It's that the people vote with their money, that those decisions turn into efficiency. And and so what you have to balance that, of course, with morality too, because if we really made it, like we said, a capitalistic system, then the rich would live and the poor would die,
Right.
and would die of easily preventable diseases because they didn't have
They
any
do,
money.
which they do, because there are 47 million uninsured Americans, and they are amongst the category that is getting the highest mortality rates by coronavirus, for instance.
And I mean, you have to ask the question, was what came first, the chicken or the egg? Are people unhealthy because they're mentally unhealthy, or are they unhealthy because they're mentally unhealthy because they're physically unhealthy?
I think that that's a big question. I'm not sure whether this is
I'm just saying it's worthy of considering.
Yeah, I think so. But if you think about it, that's no difference on whether that happens to a private or public healthcare system,
Mm-hmm.
because the circumstances under which that happens are similar in both cases. To me, it's a question of what does serve the best, what is the most efficient system, and what provides the best standard of care for everybody. But also, it's a question of morality and moral standards. By the concept that you tell me, about, when we talk about capitalism or libertarian thinking, by the same concept, we should get paid every time we go to a different country and bring the army in there. We don't actually should get money for our army to go and liberate countries under oppression, right? We should be paying. We should get a bill from 911 from the police if we get burgled.
Right.
If
the fire department or whatever, hey, if repairs need to happen on your street for electricity or plumbing or sewage, well, maybe you should be charged extra because you happen to live on that street.
Right. So again, it's an argument that seems to me very kind of segmented to certain aspects. And to me, that comes to what is a constitutional right to the people. What are human rights and what are nice to haves. And to me, that is where the majority of the debate between liberals and conservatives should happen. Well, let's not talk about cost, because the cost issue is not there. It's a single payer system is more efficient, full stop. You can't argue with that. It's cheaper. And
The only place that they argue that it's going to be more expensive are one with exorbitant, or experimental treatments, right? It's like, oh, if you ask for all sorts of experimental treatments, it could make the costs balloon and it would be more expensive. And that's why with Obamacare, they complained about death panels, because people had to decide whether a panel had to come along to decide whether it was worth giving someone a very expensive surgery at the end of life, because that's the most expensive, for most people, that's the most expensive care, is the last 6 months of life.
Right, but that is not a different argument from any other socioeconomic system that is based on a capitalistic system. So if you go to Cuba, that is not an argument, right? But if you go to the UK or to Italy, there is the same arguments, because they're still subjected to pharmacoeconomics standards.
Right.
So
what if you did?
Ideal, but it's not different.
But what if you did have a system where you were voting with your dollars, and or at least there was a copay to everything that was a percentage?
So that's how it works. For instance, so the difference between the Italian system and the UK system is that in England, regardless of how much you make every year, so if you make $10,000 or you make $10 million, you have exactly the same coverage to the national health system. In Italy, it's a little bit different. You actually pay a copay, you have a copay according to your income. So you pay healthcare on your tax bill, and then if you earn above a certain amount, you have to pay a certain contribution. And the highest your income, the highest is the contribution. So that gets back into the system, which actually works, because then it supports people. And then
does that influence decisions by customers? So if they have a copay, does it influence whether they're going to get that treatment or not?
Not really. It's very much the same.
Because I think that's what the libertarians would be arguing for, is if you put free market capitalism somehow into the healthcare system, then the decisions that consumers make will somehow change and make the system more efficient.
You can still have, in Italy and in Rome, for instance, there are hundreds of private clinics. And you can go, there is a very famous movie, which is called The Doctor of the, I don't know what Mutwa is translated in English, but basically of the national health system. And it's a comedy story about this guy that becomes a physician and kind of works with the national health system, and then says fuck it all, and he starts his own private clinic, and he makes a gazillion dollars. So there are plenty of private clinics, and people go private when they want a faster outcome. So, for instance, now my mother needs to have an echogram on her abdomen, and the sooner appointment that she can get onto the national health system is in November. If she goes private, she needs to pay 85 euros and have the appointment probably in October. There is that option. And the thing is that because of the public surrounding and the lack of a middleman, the costs are significantly lower. With my own, again, $750 a month I pay, I went for a CT scan, and I had a copay of $300. I went for a procedure, as you know, and I had another copay of $300. So I go to my doctor, and I had a copay of $25 every time I go to the doctor. So it's not like my insurance is actually covering everything. But I don't have a choice on which doctor I go to, because I am, to save a little money, I went for an HMO, and therefore I got to be within network.
Right. Now, I got another big question for you here. I'm sorry if I'm taking us off of the topic, but my father told me the other day that he had to, he'd fallen off a ladder months ago and knocked himself out, and he went to the emergency room, and he was there for like 2 days, and then the bill, it was covered, it was mostly covered, but the bill, if it hadn't been covered, was for $30,000.
Yes.
And he's just like, how is that possibly in the realm of efficiency? Like, how does that make any sense? How could you possibly charge that much money for someone taking up a hospital bed for a couple of days and doing a couple of tests?
Well, medical equipment is really expensive. Everything is single use. Everything needs to be sterilized. Everything has a chain of transportation that requires a lot of quality control. So there are a lot of costs associated with the healthcare, and they are massive. It's huge. The amount of money that you think, how much does a piece of gauze cost? It costs a lot of money for what it is. It's quite ridiculous. And then you have.
But why is that? Why is it so expensive? It's gauze. I mean, why is gauze so expensive?
Well, because it's got to be, again, you can't just get some gauze, right? Because, so for instance, I found out in my last hospital stint that they actually throw away, the bands that they use to take a blood, to kind of turn your arm to take a blood test. They actually have to throw them away. So they are single-use elastic bands. And they need to be sterilized, so they autoclaved into a packet that comes with everything that you need to take a blood test, and then everything is single use. So the chain of, and that is because they need to avoid litigation, they need to avoid problems. Everything is accounted for and everything is counted. Because too many patients have been kind of let out of hospitals with kind of surgical instruments into them, or stuff attached, and they lose an arm or a leg because they didn't take off the band. So there is a lot around this. It's more expensive here than it is anywhere else, because that is the non-negotiated. So the cost on the hospital bill is actually the non-negotiated cost. So if you were not insured and they gave you everything at full price, you would have to pay $30,000. The insurance is never going to pay $30,000. The insurance is probably going to pay $10,000 of that $30,000, because they negotiate a discount. Each insurance negotiates a different discount with the hospital. In a public market, it wouldn't be the hospital setting up their price. It would be a central agency that says appendix removal is $3,000 instead of $15,000. A heart bypass is $250,000 instead of being $1.5 million.
Now, does that reduction in cost hurt the doctors or the nurses in any way? Do they get paid less because there's a government negotiated cost?
Well, yeah. So yes, that's where kind of that hits. So doctors in Italy or in the UK, hospital doctors don't earn as much as they do in this country. I have a friend, he's a head of division in an oncology department, and his salary is around $3,500 a month, $4,000 a month, which is a good living wage in Italy. but certainly is not, it doesn't buy you a yacht or a vacation to, exotic places. In England, a head of department, last I know, now they might be higher. I had a friend of mine. She was head of neurology at Cambridge, at the Cambridge University Hospital, and she was on about £140,000, which translates around $200,000 a year, which is a good salary. But here, like in Italy and in the UK, doctors work in a public hospital and then they have private practice. In private practice, they can charge $300 per visit, $400 per visit, and that could be negotiated with the private insurance or not. So there are also private insurances in these countries that give you the supplemental services and access to private structures. So I don't see why we shouldn't have a mixed system where you have a reduced use of health insurance and at least a baseline for everybody to deal with day-to-day medical problems. Because it seems to me that there isn't a big difference. When you go into that, there isn't a huge difference.
So I think a lot of people, conservatives and libertarians, would complain that we might lose, that good doctors in America might go to other countries to make more money if we had a fully socialized system.
But that's another question about, why do you become a doctor? Do you become a doctor because you want to, provide a service, or because you want to become a millionaire?
Right, but being a doctor means that you have to do school for like 12 years, and there's it's a kind of a high stress job. If you're a surgeon, it's a high stress job. There's lots of factors. There's lots of risk about what you got to be on your game and not make mistakes. And so it's like, well, shouldn't doctors be compensated, at a proportionate level to their responsibility? But I think you get into the moral issue when you talk about what is my life worth, because there's no amount of money you can set, to an individual's estimation of what their life is worth. And so then you have everyone around the barrel, essentially, when it comes to setting the cost of emergency life-saving healthcare.
Well, again, in this country, you pay for everything. So, your salary needs to be a lot higher than. So I went to medical school in Italy, and my school fees were about $2,000 a year throughout medical school. Oh. In England, I think is about $3,500. So again, the concept of I don't have a bill to pay for the rest of my life because I've been to Yale and I pay $250,000 a year.
Right.
That's also the difference. And I appreciate and understand that. I wonder whether there is so is the doctor that comes out of Cambridge University better or worse than the one that comes out of Yale University? I would argue that probably not, because they're kind of both world-leading organizations, right? And world-class educational systems.
And the money reward isn't the prime motivator for most of these people. And that's what I think we not economics, we get caught up in people assuming that money is the only reward for good work, and that's what motivates people. And that's just not true. Gamblers, it motivates, and it motivates people who like extrinsic motivation because they don't have enough intrinsic motivation. But we know psychologically, intrinsic motivation is more powerful and more long-term effective for people than extrinsic motivation. And extrinsic motivation actually corrupts the intrinsic factor. And I think if we go back to the libertarian argument in the book by Ron Paul about how hospitals used to all be run by the churches and they were better that way, it's like, well, yeah, when people have a mission or a sense of purpose.
Yeah, but those doctors weren't get paid millions of dollars, right? They were getting paid like a living wage, but they weren't rich. Again,
No,
if you
because
look
they
at
didn't need to be rich. They was rewarding, the job was rewarding in and of itself. They
right,
just needed to be able to survive comfortably enough to keep doing it.
right. Again, if you talk about this, when you don't have university debts, when you live in a country where there are a lot of services that are provided as human rights, like education and healthcare, then a living wage of $150,000, $150 to $100,000 is actually, in the top 10% of the population of that country. So you're not literally starving, right? It is in this country that if you earn less than $70,000, $80,000, you don't know how to make, um, you know, ends at the end of the month, and you're struggling to pay bills. It's a different proposition, and it's a different scale. But again, to me, that goes, before the economic factor, before the evaluation of what is better and what is worse. The question that we should ask ourselves is, what are fundamental human rights? Is the right to health a fundamental human right that comes the moment you're born and finishes the moment you die, or is something that you have to pay for?
And I would argue that, if you look at human history, of course the answer is no, that it's not a human right. But if you look at the current state of the United States, the wealthiest country in the history of mankind, the idea that you wouldn't, as a tribe, push the witch doctor in town to service everybody in the tribe because we can definitely afford it, I would argue that that's an immoral decision.
Well, you're talking, when you're talking about history, you're talking about history from the Industrial Revolution, right?
I'm just talking about human history. I'm talking about 10,000 years of civilization.
Well, I think that it's only recent that access to healthcare was denied to the poorest.
Yeah, exactly.
Because when we were in a tribal, we've been in an urban civilization only for about 400 years, 500 years. During the tribal phase of civilization, healthcare was provided to everybody because each community had their own healer or physician or witch doctor or witch that was addressing the needs of the community. So it's only when we went into urbanized and with the Industrial Revolution that healthcare became a problem, because there was a divide between the rich and the poor, because everything became money based.
Right.
But before, there was barter, which was actually the currency for most things.
So how do you think, if we were to create a hybrid system like you're talking about, what would the hybrid system that look like that gives us the moral backbone of everyone is taken care of, but also uses money or capitalism or some other tool to keep it efficient, so that it's not just people resting on their laurels and the system just getting bigger and more inflated while people get lazier?
So I think, personally, I think that I favor a system in which there is two factors: that there is an individual contribution regardless, excluding people with a lower income and people with certain conditions. So that's what I like about the Italian system. My nephew had cancer when he was in his early 20s, and as a cancer victim, he doesn't pay any extra cost regardless of his income. And a system in which people are able to access healthcare without having to worry about money. So to me, that is the primary standard. Then I think that it's adequate and fine to have a parallel private system. which might have a health insurance, might have. So I wouldn't go to the extent that Bernie proposes of eradicating private insurance altogether. But there is a space and a time for that. That shouldn't be in competition. So the state option should be competitive to the private option, which includes the negotiation of prices for procedures and medicine that should be decided centrally and be the subject of negotiation.
So essentially, this sounds a lot like Obamacare.
Except that Obamacare didn't take it far enough, in my opinion. It still relies on a per-profit system. The shift that needs to happen is healthcare moving from a per-profit to a non-profit system. So
Is that's moral?
The provision of healthcare is something that you do, like you provide passports, or you provide police services, or you provide, any kind of government. You provide an army and defense for the country.
And while people are afraid that this is going to be less efficient, there's plenty of arguments and strong mathematical arguments that it's going to be actually more efficient if and when we pull the trigger.
That's why I think that the argument is ideological rather than,
Right. It's just fear of socialism.
It's a fear of socialism. It's a distrust of a government. So instead, I trust Cigna or Blue Shield more than I trust the government, which to me is absurd, because the government is something that I can actually have a stake on, right? I can go and vote.
Right.
Instead, Cigna and Blue Shield, I don't have any stake in electing the board of directors or questioning their profit margins.
Right.
So again, to me, it seems like almost counterintuitive.
It does get a little religious at a point. The libertarian argument, it's mathematical to a certain degree, and then it becomes religious when you just say, well, but I'm paying dollars. It's like that doesn't necessarily influence the behavior of a company.
The alternative is to say, okay, you want to make it competitive, you want a pure capitalistic system, then you need to break everything down so that there is real competition.
Right.
And you got to allow players to come in and provide innovation, different solutions. And
the problem with that, of course, is that people get punished for experimenting and for cutting costs and being more efficient, and especially in healthcare, when life is at stake. Those are the biggest lawsuits.
Because we are not, again, Andrew, there is this conception that we are in a capitalistic society. We are not in a capitalistic society. We are in a plutocracy where there is a dominance of a limited number of corporations and conglomerates that do not compete between each other, but take a share of the market.
Yeah, they just coordinate, and that's supposed to be illegal. There's supposed to be antitrust legislation supposed to be applied to that situation and break that up, but it's not really happening.
So it is the ideal of capitalism. I buy into. I love capitalism. I think that's a true motion of human purpose, and I think that capitalism gives you the motivation to innovate. However, this isn't capitalism, and healthcare is not the place where you should make money. That's my point.
Because it becomes disgusting very quickly when you're more concerned as a doctor, you're more concerned about how much money you're going to make off of this procedure than you are about choosing the right procedure for your patient, or how much kickback you're going to get from this drug that you're pushing, rather than telling the patient, listen, I don't want to give you any drugs. You need to exercise. You need to eat better. You need to stop doing these crazy, unhealthy things. I'm not going to enable your terrible behavior. Like that, but that's not going to make you money, and it might get you a complaint through the
Yeah,
system.
that doesn't. That is a deal, but Andrew, that doesn't happen in England, and it doesn't happen in Italy. So the doctor is not able to tell you, I'm not gonna treat you unless you do this.
Well,
You have a
I
duty
don't
of
know
care.
how. I
Yeah.
understand this is not, again, I'm again swinging away from the question of single payer or not, but like this to me is like at such the crux of it at a cultural level is we're not thinking about healthcare properly. And if we did, it would half the cost of healthcare by itself. If
But
people
that's
took
different.
more
Yeah.
care for their bodies and really thought, I'm going to take responsibility for my health and not leave it only up to these doctors, then we would have a healthier populace to begin with, and there would be far fewer of these medical procedures and drugs necessary.
Yes, I think that you're talking about the kind of stage 2 of the healthcare revolution, right? So it is impossible to achieve what you say in the current system because the current system is all geared up to being remedial. So you go there when you have to. So you don't prevent, you just treat. But there is so you can only do that on a substrate of a free healthcare system or a public healthcare system, because that gives you encouragement to actually go and see the doctor at the first symptom,
Right.
or if you have a developing problem.
And from what I know from some of the people I've worked with creating online courses, a lot of autoimmune diseases are being discovered to be developing for decades before they actually have symptoms. And so if people were getting blood work in their 20s, even though there's no symptoms to suggest they need medical help, they would be able to pinpoint allergies and health issues in their diets well in advance. Is it you think this is spurious science?
I think that's kind of that's kind of spurious science. There are, but there are a number of factors that occur in order for people to develop certain diseases. Certainly, trauma, stress, deprivation, anxiety, depression predispose people to a pro-inflammatory setup, which actually creates a substrate for autoimmune disease. So there is, for instance, a study that shows that patients with autoimmune diseases are more frequently victims of childhood abuse than people without autoimmune diseases. So there is certainly factors, whether you are grown up in an urban environment or you're in a rural environment, you're more predisposed to autoimmune disease. Certainly, there are a number of environmental, social, and health factors. Whether you can actually prevent or convert an autoimmune disease on the basis of a pre-test that you can do, I haven't heard that before. Quite frankly, that's new to me.
Well, it is sort of new. It is sort of new, so I guess it may still be up for debate, but it's
I should know because that's kind of like my bread and butter. That's what I eat.
Yeah, well, Doctor, some of the online courses I did were for Dr. Tom O'Brien, and he was quoting a lot of Harvard medical research with elevated antibodies in blood that suggested early stages of immune reaction to normal foods and people becoming allergic to things later on. Anyway, I don't know enough to vet that data, but
I think that potentially, yes, early screening. We don't have to go esoterically to autoimmune disease. We need to talk about cancer, right? Cancer and cardiovascular disease, the two largest killers in this country. So if you have early screenings and people weren't worried about going to the doctor because they have to pay, you would have a much higher success rate in treating cancer and decreasing later costs. Same with cardiovascular disease. If you go to the doctor and you get monitored, you're less likely to actually develop irreversible heart disease.
Right. And
So
and I'll just mention some things that are really close to everybody, like the dental and the eye stuff that's not covered generally. Like
yeah,
dental can kill you. People can die
yeah,
from your teeth falling out and having infections in your mouth.
that's
People,
that's not
ha-
covered in England either.
yeah,
No need.
having eye problems can stop you from working and can cause accidents. I mean, these are things that it's to me it's crazy these things aren't covered by standard insurance because they're essential services. They're essential care.
And that's where the pharmacoeconomic argument comes into place, and the remedial versus preventative medicine type argument comes into, because the more distant the causality is, the more difficult it is to justify an investment.
And
So
let me
there
make
is public dental care and vision care both in Italy and in the UK, but you don't have a lot of people that go for these services because there you have to wait for months and months and months, and then you're in the hand of a third-year student instead of somebody that has 10 years experience. Then there is all that kind of all the problems that people think will come from public healthcare actually are in kind of mass services like dental and vision. Um, and those are limited in even countries where there is a perfect healthcare system. At least the ones I experience. I know that there are countries where everything is paid for, but I think those are kind of very small countries, like some Scandinavian countries where they have like 15 million people.
right.
Um,
Yeah,
right.
they do things better in countries where there's a fairly strong economy and not many people to support with it.
Well, that's
And a a homogenous culture that doesn't have
right,
to
right.
argue much. Yeah,
Yeah.
they do pretty well.
Yeah,
So,
Iceland is amazing. They got like 150,000 people, so it's like
which country? I'm sorry.
Iceland.
Iceland. Oh, Iceland. Yeah.
Yeah.
So let's wrap this up, Fabio. Is there any other big ideas that you just want to lay down as sort of the wrap up finale here?
I mean, I don't know whether I got any big ideas. I just think that I would like to. It's really, I think it's really bad to have this type of conversations starting from an ideological perspective and then going into the merit. I think we should have those conversations based on merit. So what does make sense? What doesn't make sense? For instance, the question, what is a human right? Right? So why is it not a human right? How is different? How healthcare is different from defense or from policing or from the fire services? Um, I remember that in the 70s in the US, people were turned away from the ER department. Um, what was that TV show? San something. Uh, uh, of the public hospital that was getting all the rejects and all the people that kind of were kind of kicked out of the big private hospitals.
Was
There
it a
was
comedy show or was it
it was like a serious one. It was
is
like
it General Hospital or is it ER or what?
yeah, no, it was before those. It was like
Oh,
uh,
okay.
I found out, but there was a reality here where people would not be able to have care, even if they needed it, even in emergency, and and I think that that's not humane, and that's certainly not something that the leader of the free world should be proud of.
And I would just add on top of that that mental health also stems from physical health to a large degree. And so when people are not getting basic health care, little things that might improve their health, and just knowledge, just education on how to take care of themselves, we're losing intellectual capital in our general workforce. We're losing productivity as a country. So the economic arguments for this are actually very strong. because we as a country would do better if we had a healthier country.
Yeah, I believe that is the case. And also we would not be paying more. This is the principle, is that financially it makes sense. Intellectually it makes sense. Morally it does make sense. There is the only misconception that goes against the concept of healthcare is the perception of what might happen uh, in an isolated, non-historical perspective.
So it's basically a conspiracy theory that
It's an idea.
stops people.
It's a fear. It's a fear-based ideology that tells you, oh, you got this now. For better or worse it works. We go into a new thing that nobody's ever experienced before. When actually we are only one of a handful of countries not to have public healthcare, and it's working everywhere. Nobody wants to go. None of those countries. If this was such a big no-no, and if this was such an advantage to go to a private healthcare system, and if, as it is true, American culture is influencing, of most of the Western world, then everybody will switch to a private healthcare system. Why at the UK still, public healthcare, basically the NHS is the most loved organization after the post office.
Wow. Wow. Because the government takes care of people. When the government takes care of people in a tangible way, they feel it and they actually begin to respect where their tax dollars are going, right? But I guess the libertarian argument would still be that it's a slippery slope. Once you get into socialism, you can't get out of it.
It's what is a slippery slope? I mean, we're talking about countries where there is no socialism. The UK is not a socialist country. Germany is certainly not a socialist country. France is not a socialist country. Italy is by no chance a socialist country. None of those countries. Scandinavia, there is no socialism in any Scandinavian country. The all capitalistic base, private enterprise is the core of all of those countries. I just think that the evidence defeats the argument in itself. And I think that you can only think in this way if you practice this ideal of American exceptionalism. So the idea that Americans are different from everywhere else, and therefore what works somewhere else doesn't need to work in the US.
Well, that's it. Thank you very much, Fabio. I think we've summed it up. If anyone has some counter arguments we haven't addressed, please post them, and we would gladly answer them.
Yes, I would love to. As I said before, I think we need to have more debate with opposing views, because you and I, again, you can play a little bit devil's advocate, but fundamentally we agree on a lot of the issues.
So I will moderate debates with Fabio, with anyone who'd like to debate. I'm going to vet you. I'm going to vet anyone who wants to debate Fabio beforehand, but please volunteer to debate and I will moderate.
I think it would be great. Yeah, thank you.
Thanks, Fabio.